Hello everybody. We're here for a Facebook Live event. Hopefully, I'll make sure that it's actually coming up on the Facebook Live little monitoring here. And yeah, it looks like we are. Okay, great. So this is a Facebook Live event talking about influenza vaccine. Just to introduce myself, I'm Steve Pergam. I am an infectious disease physician and the Director of Infection Prevention at the Seattle Cancer Care Alliance. I'm also a faculty member at Fred Hutchinson Cancer Research Center and at the University of Washington. And as a infectious disease physician, I'm of course interested in protecting patients from getting infections. And one really important way to do that when it's respiratory virus season is to get the flu vaccine. So I'm here to talk a little bit about flu vaccine and why it's important. And I'm specifically interested in this because I work at a cancer center, and patients who are going through cancer and chemotherapy are at higher risk for developing complications from influenza. And so whenever we have the opportunity, we want to get out to the public space and talk about the importance of this, because what you may be getting as an individual at home, it may really help prevent some of those high-risk patients from getting flu. And if we can avoid cancer patients from getting influenza, that can be a huge benefit in terms of them getting treatment. So if we have somebody who's got a curable cancer and they develop influenza and develop a life-threatening complication, then that's something that we want to do everything we can to avoid. So why get the flu vaccine? Well, for the general individual, if you've ever had flu, and I certainly have, it's pretty miserable. Generally, people will describe being sick with having runny nose, cough, sore throat, oftentimes what's called myalgias or body aches. You can have high fever, and you can be pretty ill. Even a normal host who's getting an influenza infection, who doesn't have cancer or immunocompromised infection, can develop major complications. And it can be something as simple as being away from work because you're so ill and you can't get out of bed. It can also mean that other people in your family can get exposed to a major pathogen. And a lot of people have people at home that can be quite sick. So if you have a young child that's under a year of age who can get flu, that can be high risk. Or if you have an older family member who lives in the house, sort of a grandparent, that can also be somebody that can get quite sick with influenza. So it's important to protect your family and to protect yourself by getting the vaccine, because that's one way to really make sure that you are protected. So just as a quick comment before I keep going here, I want you to know if you have questions, you can post them below down here at the bottom, and I'll try to get to them to answer the questions. I've got a couple people standing with me here that can hopefully feed some of the questions to me so I can keep my eye contact here. But I also just want to give people an opportunity, because there are questions that many people have. I spend a lot of the year answering questions about influenza and influenza vaccine. I want to make sure I do my best to answer them. If I can't answer them specifically, I'll try to give you resources of where to look, and then I'll also be happy to sort of try to address the ones that I can, that you have the best I can. Because we don't know the answers to everything, but we do know a lot about the flu vaccine. And one of the questions that comes up all the time is how safe is the flu vaccine? People are concerned. There are comments that some feel like there's negative effects of getting a flu vaccine. And I would argue that of all the vaccines we give to patients, it's one of the best studied. Unlike other vaccines which you get once in your life, the flu vaccine is given yearly. We need to make that yearly change because the flu virus changes slightly every year, and so we need to revaccinate people to make sure they're protected from that seasonal version. So it's been studied extensively in patients and has been found to be safe. We would not give it to patients if we did not feel that it was safe. I can tell you that I already had my flu vaccine this year. I'm a little different than most. I got it super early because I was traveling to Australia, where there is a lot of influenza this year, and I wanted to get it early to help protect myself before I went. So I got it early, but many of our colleagues here in the center have already started receiving the vaccine, and we have really high rates within the medical community. 95 to 98% and higher get the flu vaccine, which tells you that if we're getting it, we believe in it as well. So I think that's really important for patients to understand. we feel so strongly about it at the SCCA, or the Seattle Cancer Care Alliance, that we actually provide free flu vaccines to patients' families and caregivers, because we want to protect patients who are coming into the center to be seen. We, of course, give flu vaccine when appropriate to cancer patients, but generally people who have altered immune systems, who are getting cancer chemotherapy, don't respond as well to the vaccine. And so if we can give vaccine to people around them and sort of cocoon them in protective way, we can hopefully decrease the amount of flu they get. So it's really important for us to address that. So let's maybe go through a couple of myths. Looks like there may be one question here. So I got a question. I have stage 4 metastatic breast cancer. We just got ours yesterday. And how I wish those who could get the vaccine would please get the vaccine, especially to protect those of us who are compromised. Helen, thank you for that comment. It's really important. I'm not sure if you know this, but I'm also a cancer survivor myself, and I'm totally in your camp. I believe this, and I think it's really important. I think when you're a cancer patient and you're going through treatment, it's an incredibly vulnerable time frame. And what we forget is that going out into the community when it's flu season can be a really terrifying event, because if you catch one of these viruses, it can be, again, life-threatening. And I want the community to know how important it is for our patients and for the loved ones that many of you have that have cancer or have other conditions that put them at risk for flu, that if you get the vaccine, you can help protect them. And that, I think a lot of times people worry about themselves, and I understand people have concerns about what they put in their bodies, etc. But I think it's also important for the community to consider those who either don't respond as well, or those who do develop flu can be really dangerous. And so get your kids vaccinated, get vaccinated yourself, and it's a great way to help not only protect you and your family, but also the community. So Helen, thanks for that comment. And kudos to you for getting your flu vaccine, and I encourage you to get your family members vaccinated. And if they need to get their vaccine, bring them to clinic with you at the SCCA, and we'll get them vaccinated for you. So let's go through some of the myths. I think it's really important. So one question I get all the time is, I got the flu vaccine and then I got the flu. And the reality is, the flu vaccine is not the influenza virus. I do not, when I give people the vaccine, give them the virus. There was a type of flu vaccine that was available for a long time, which was a nasal vaccine that you could, primarily aimed at kids. That's not available this year, and that actually was a strain of flu that was weakened and allowed people to respond immunologically to the vaccine, which was this live virus strain that could only live in the temperature range in your nose. But that's the only version of live virus vaccine we give. All the rest are component vaccines that are not related to the virus. So if you get the vaccine, you don't actually get the flu. If you get symptoms, sometimes it can be a sore arm. People might have kind of a general kind of achiness or some mild symptoms like that. Some people have more acute responses and a little more symptoms. I would talk to your doctor about those events specifically. But generally, most of the responses are benign, and they're really mild symptoms. If you do develop respiratory symptoms, a cold or flu or runny nose, remember that it may not be flu. It could easily be rhinovirus, the common cold. It could be another infection like metapneumovirus or RSV, and that sometimes we get those viruses at different times in the season, and they can happen around the time when flu vaccines are being given. So don't always assume that your symptoms are related to the flu vaccine. I think it's really well studied that that's really not related with that, and certainly you can't get the flu from getting the flu vaccine. That's a myth. So I hear a lot of times from patients that I've worked with. I used to be a primary care doctor, that they said, I don't need to get flu vaccine. I'm healthy. The reality is that healthy people every year, not a lot, but the ones that do, can be devastating. They can have major complications. There's been deaths every year. There were 200 to 300 deaths last year from influenza in the state of Washington. Many of those were high-risk, immunocompromised, older, and really young patients, but some of those were healthy adults. So you can't always predict who develops complications like this. It can be a bacterial infection that happens after flu. It can be the flu itself that can lead to things like myocarditis or inflammation around the heart, which in some situations might lead you to need a pacemaker. There can be complications where it can get in the brain and cause meningitis or encephalitis. These are rare, but when they happen, they're devastating. So I remind people that even young people, healthy people, can get complications from the flu, and it's absolutely worth your time to get the vaccine. So don't believe because you're healthy that the flu vaccine isn't important, because number one, it protects you against getting complications from the flu and, frankly, missing days of work and all kinds of stuff that happen otherwise. Number two, it helps protect everyone around you, your friends, your family, and those who live in your household. And number three, remember all those cancer patients and immunocompromised and people with chronic lung disease or heart disease, things that would put them at risk for developing high-risk flu. You're helping to protect the community as well. So it's really important. So getting the flu vaccine is all you need to do to protect yourself from the flu. And I think that's really an important distinction. The flu vaccine is a component of a suite of options and things that you can do to protect yourself. So one thing I always remind people is that using hand hygiene is really important. So this is an alcohol-based hand sanitizer. Washing your hands on a regular basis is very important. So when you're getting on public transport, or you're going to the movie theater, you're going to the grocery store, have some hand hygiene around and just use it in between events like that, because one of the best ways we can spread flu is to touch surfaces and then touch our faces, or touch our fingers to our mouths. I mean, if you look at how many times we touch our faces, it's quite a number during a day. And so you have a lot of chances to rub your eyes or get something in that could lead to clinical infection. So your hands are one of the most important ways that we actually transmit infections like this. And so it's really important that you make sure that you are using hand sanitizer on a regular basis. The other thing that's important is, if you do get sick or you have symptoms, make sure you go see your doctor. So part of flu prevention is also, when you develop flu symptoms, to get seen and talk to your physician, because some people can really benefit from getting antiviral therapy. And if it's flu season and you are at risk for developing complications, then getting a drug like oseltamivir or Tamiflu can be helpful in limiting your symptoms and potentially protecting you from other complications. So I think that's really important. Big things you can do during a season like this is get your flu shot, get your family their flu shots. Make sure that people understand to wash their hands, particularly kids. Great time to teach them how to wash their hands well and to use hand sanitizer. And then what I typically tell people who are at high risk is, if you can, try to avoid crowded spaces. Don't go to the movie theater during the most important time of the year when it's super crowded. You might go at an off time if possible. And if you can, try to avoid as much as you can the big crowded spaces and go a little bit off time, particularly for those who are at risk for developing complications like that. So some people feel like they don't need the flu shot every year, and that's another important myth to really exclude. And I think one thing that's important is the flu vaccine changes every year because the flu strain changes every year. It shifts slightly as it moves around the world. And right now we know that there's a lot of influenza in Australia, and we're expecting a bigger season here. And part of that has been they've done vaccine, but it may be that they just had a slightly more severe strain this year. It was more easily detected. It looks as though so far the strain predictions look good. But one place you can look, a really, really cool resource for those who don't know this, is you go to a site called NextFlu, NEXTFLU, and it's run by a colleague of mine named Trevor Bedford, just to show you some of the thoughts that go into developing the flu vaccine. He works with the WHO and others to help advise, and what they've done is they've looked at sequencing data, meaning looking at the actual, how the virus is made up, and how that changes over time. And they help predict what might happen over the next few years. And he's got some really interesting data that they've just published related to September. And so I would encourage you to go look at that site. Again, it's called NextFlu. And I believe it's nextflu.org. I'll double check here, but I think that's what it is. Anyways, it's really interesting. I'll just look up Next Flu, and it's all one word. You can get some sense of what's going on about that, and I think can really give you some insights into some of the challenges in making decisions about what goes into the flu vaccine. But importantly, every year, get the flu vaccine, it changes, and so each yearly vaccine is really important. Some people think that getting the flu vaccine, they'll just wait until the season comes. Get it early, because it takes about 2 weeks before the flu vaccine becomes effective. And so it's really important to make sure that you get the vaccine early enough. So I tell people, as soon as it becomes available, get out there and start getting it, because it's really important to protect yourself. So I've got a minute left or so, trying to think of other things that are really important. One thing I really talk to patients about, particularly with flu vaccine, is that one of the reasons I want people to get flu vaccine is that when you get flu, you're symptomatic for at least 24 hours before you actually have symptoms. You're infectious 24 hours before you actually develop symptoms. So the flu vaccine helps you prevent you from getting the influenza virus at all. So that means you're never going to be shedding the virus and potentially passing it on to others. So it's important that as much as you can, the vaccine can really protect you from even spreading it asymptomatically to high-risk patients. So I think that's important as well. So getting the vaccine helps to prevent those asymptomatic infections. So I think we've talked for about 15 minutes or so. I really hope for those of you who are out there on the fence, talk to your doctors about this. Find out why it's important to you, why it's important to your family, and again, think about the community and some of the patients who are out there. And if you're cancer patients, please talk to your doctors at the SCCA or other locations and make sure that you get the vaccine. Really important. I think it's critical that you take the time to do that. So there's one question here. There can be more than one option for flu vaccine to give. Which should I choose? That's a great question. That's from Erica. Thank you, Erica. There are a couple of vaccines that are available. So at the moment, there is the seasonal vaccine, which is a quadrivalent, which is primarily chosen. It's got 2 influenza A viruses and 2 Bs, and that's what most people get, and that's recommended as a primary vaccine, what most of our patients and most of us get. If you're 65 and older, you can also get 2 other types of vaccine. One is the high-dose vaccine, which is many times higher dose of the antigen or the specific components of the vaccine that protect you, and that's actually recommended and shown to be very beneficial for people over 65, and it's in fact what I recommend my parents get, which they did. And it is it's important. It's only 3 viruses. It's not the 4th. You're missing 1 B, but we think it's protective enough against the other components of the flu virus that it's important that the high-dose vaccine can be very valuable. And then there's also what's called an adjuvanted vaccine, which gives you a little adjuvant to improve your responsiveness, called FluAd. That's also been that's available for 65 and older. So talk to your healthcare providers about which one might be best for you. I think another question here. If this year's flu vaccine doesn't end up matching the circulating flu strain, is it still worth it to get the vaccine? Great question. Thanks, Trent, for asking that. I think absolutely it is. These are, sometimes the idea is that if it's not a great match, it means I got the flu vaccine, I got no benefits. Well, remember, there's components of the vaccine. There's a B component, and there's 2 A's, and oftentimes a 4th B. And so depending on the season, you may not have a great response to the A portion of the vaccine, but you'd be well protected against the B portion, or vice versa. It really depends. Some seasons we don't have great responses, but you can't predict that ahead of time. So really important to get vaccinated first. Because if you get vaccinated and you find out it's not a great match, well, you've done everything you can. And even if it's a 10% or 15 or 20% response, I feel like any protection is better than 0. And so I really push people to get it. Even in situations where I know the vaccine match is not perfect, because there can be components where it can be very valuable. So in seasons when we've seen low response rates in vaccines, and we have seen really good responses to the B component, and so people have been protected against B, because there are more than one strain of influenza. It's both influenza A and B that's co-circulate at different times in the year. Usually A comes first and then B. but sometimes we have bigger B seasons like we did 2 years ago. So it's important to protect yourself against both. And important to get the vaccine regardless of whether you hear that it might not be a great match. And so far it looks like it's going to be, but we just don't know for sure yet. So I want to thank everybody for taking time to listen to this. For those of you who have questions, again, you can post them below. I'll try to come back later today and take a look at some. And I encourage everybody to go out and get vaccinated. I'm making sure that all our staff do here. We spend a lot of time doing that. And we really want to get as many patients vaccinated this year as possible. And excuse me, and making sure we get the community vaccinated too. So I'm going to hand gel, and then I'm going to see you guys later. Okay? Thanks a lot for spending time with me.